Right, I'm going to hit the button and send it live.
Do you want us to all mute for now?
Yes, please. There you go, Councillor Scott. You're on live.
Good evening, everybody, and thank you for joining us at our very first virtual Sutton Vesey ward meeting. I'd like to welcome you and pass over to Rob really at the moment to say hello. So over to you, Rob.
Yes, hello to the residents of Vesey ward and Birmingham and the wider world. Our first ever pioneering attempts to do a virtual meeting when we are just about learning the technology. So apologies if we're a bit slow on the mark here, but luckily we have as the co-chair tonight Kath Scott, who is a whizzo on modern technology. And so before we get into the meeting, Kath is going to talk you through, as viewers, how the meeting will be run and how to interact by entering the chat facility if you've got questions you want to ask. So Kath's going to take over from now, and I'll be coming back at item 5 on the agenda when we deal with the public health updates.
Okay, so we're at item 1, Chair's introduction. So the way this meeting works is to the side, as if you are joining us as a guest and watching the meeting, you should be able to see a chat function. In that chat function, you will be able to put comments and questions to any of the speakers and to Rob and I, and we will read them out to the speakers for you, all questions that you have. Anything that you put on there is completely anonymous, so if you don't want it to be viewed by the rest of the general public, please say so in your comment. Keep private, and we won't publish that either. Secondly, we'd also like, as we always do at the beginning of our meetings, is we get everyone to sign in. So if you want to receive bulletins and updates, pop in the comments section your email address and your name, and we will keep that privately, and we'll keep that on a database so that we can update you with further information going forward. So it's onto the notice of recording. It's down to me to advise that this meeting is being recorded and it will be held in public, and the recording will be made available for public and future use. Next on the agenda we have Carl Randall, our highways engineer, who will be giving an update on highways. So please post your questions in the comments section. They will be adjudicated by Leslie, our BCC officer, and we will ask questions on your behalf. So can I hand over to Carl Randall now, please?
Thank you very much, Councillor, and good afternoon, good evening to everybody. Highways update. Okay, so we have been busy in Vesey ward as usual. We have completed the 3 yellow line schemes that we was working on last financial year up to the end of March, which included Knipersley, Britwell Road, one other road, can't quite think top of my head, but they're all in place, all complete. There was another scheme we was working on, Church Road. There was a little more complex because of residents and their need for parking, the football club and their needs, church, and also to retirement homes. So a little bit complex. We tried to do a reasonable amount of work, but not too much, not to remove all the parking. So that scheme is largely complete. I say that because there's about 3 sections that the lining crew haven't quite been able to get in and complete due to persistently parked vehicles. Understandable at the moment, a lot of people not necessarily leaving the house, and we don't necessarily know the properties of where those people live. And there is one other location where we think a number of vehicles are associated with one property. So we're still working on that and hoping to get it completed as soon as we can. We've also completed a Glebe Drive, which was a small parking extension where we took away some grass, some housing grass for them to create a little bit of extra parking. That scheme is in place and complete. Boldmere Road, off Boldmere School, we are well underway with a scheme for 20 mile an hour and some additional markings, some yellow lines, etc. We have had some delays with this, not least for some objections early on and a number of meetings where we tried to resolve it. But once we went to the formal stage, unfortunately that tied in very early with the pandemic, and with the high number of people working from home, we're trying to get a system where we can advertise the TROs set up, and the team that does that aren't able yet to pursue that for us. Not just us, there's many schemes all tied up in this particular issue of trying to get the adverts into the paper, get them on street. We're minded not to ignore the advertising element of it just because of what's going on. People still, need to be consulted upon, need to have the right of objection. So it's a little delayed, but we're hoping to move this forward as soon as we can. We're also working on a number of safer routes to schools schemes. They're not just in Vesey ward, but we're working on them all kind of at the same time. So there's Yenton Primary School in Erdington, St Mary and St John Catholic School, Gravelly Hill, Birches Green Primary in Pipe Hayes, and New Oscott Primary in the Vesey ward. The proposal for New Oscott Primary, in light of liaison with the school and at their request and public and councillors, is to reduce the speed limit on Monmouth Drive. The proposal is to reduce it from 40 mile an hour to 30 mile an hour, just a section of it between Jevons Road and Chester Road. It's based on the stretch where most pedestrians are likely to be crossing the road. And then there's a further scheme in the pipeline. Should this be successful and the speeds come down to nearer 30 mile an hour, there's a proposal to do some additional measures in the future, perhaps around a kind of a crossing facility. Okay, moving on swiftly. Stonehouse Road and Clifton Road, they are just about in Vesey. They sort of cover Trinity and Vesey. These two roads we've been trying to have resurfaced, possibly 8 years.
Yes.
It's a long time coming. They were to be done in March, April, and they fell foul of the pandemic as well, because as we were imminent to do it and we'd done the legal orders for the resurfacing, we'd posted the notices on street to say your road will be closed these hours, etc. And then everything came to a standstill, including all highways work at the time. Things are picking back up now. Programs of works are back in place. There is a new date, and I'll be a little cautious when I say, but Somerville Road, approximately the 29th of June through to approximately the 8th of July, and Clifton Road, the 9th of July through to the 21st of July. They're provisional dates. Hopefully they'll be achieved. Because of the type and nature of those roads, they have to be done on a night. So there will be some noise nuisance inconvenience for local residents. But because of the type and nature of the road, as I say, to close those in the day would have ordinarily caused quite an issue. I think now as traffic's getting a little heavier and shops proposed to open non-essential from Monday onwards, I still think it's a right decision because traffic will have increased again by then. We have had some consultation with colleagues on Chester Road, as in the entire length. There's a few key strategic routes that are having, people are having a look at them, and the combined authorities, and some of the hotspot locations we've asked them to consider include Gravelly Lane, Beggars Bush and Bannersgate Road. We haven't got an update on that. I don't know where they are with that programme. If it's anything like us, the last 2 months we've spent working on almost everything but our normal day job. We've been working on footway widening, cycle lanes, social distancing measures at shops. We've been working everything related to COVID-19 and the pandemic, so things have slipped on the normal programmes of work. Finally, we are compiling a list of locations where drop curb facilities are required or requested. This is where we drop the curbs at the end of a footway rather than for residents' footway crossing accesses, and these are for people to cross the road, so mobility scooters, wheelchairs, pushchairs, prams, just in general an ease to cross the road, because we drop the curbs to about 6 millimetres as opposed to the full height curb at 5 inches. We're compiling the list to see how many of them we can fund. And the list at the moment includes Bannersgate Road opposite the church, Somerville Road at Jockey Road, Ivy Road at Redacre Road, Ivy Road at Antrobus Road, Church Road at Browns Drive and Church Road at Warden Avenue. But as always, we welcome any requests. We can have a look and assess, and if we think it's feasible and possible. Sometimes there's utility apparatus, things right on the end of a footway, that make it extremely challenging and difficult for us to do that. But if we can, then we'll add it to the list, and always try and get the funding to try and put it in place. I think for now, subject to any questions from yourselves or public coming in, that's my highways update for Vesey.
Okay, can I request to go live, Leslie? Thank you. So, Carl, thank you for the update, and thank you very much for the additional information about the accessible Vesey ward. It's really, really brilliant to hear that it's taking real shape at the moment, especially considering the current environment and how much other work that you guys have got to do. So from the public, I've got 4 questions, so I'll start at the as they came in. First of all, is there a schedule of works for road surface replacements now that BCC has a new contractor, and will Sunnybank Road, one of the bumpiest roads in Birmingham, be included on this following the petition that we submitted via Rob 8 years ago?
Okay, there is a schedule list coming out. I've seen a provisional list. Quite a number of roads citywide. I don't recollection Sunnybank isn't on there, but I can certainly take it forward. I do know the road very well, and absolutely right, whoever's brought this up, it is a very bumpy road. And it's one we would like to try and get on the list. So yes, I will make a note of that and email our service provider, Kia Highways.
Okay, thank you, Carl. The second question, given the increase in cycling and the focus on sustaining this, what are the plans for improving the pothole situation around the town?
Okay, pothole repairs are continuing. Kia Highways, when I last liaised on this particular issue, we're at almost 100% staff resource, fit and well and at work. So all we need is the locations as specific as possible, outside a shop, a house number, a lamp column number and the road name, and then we can get those sent through. There's not many days go by that we don't report potholes to Kia Highways, and then they inspect and raise an order within a few days, and then they carry out the pothole repair, usually an interim repair with a follow-on permanent patch repair. So just give us the locations.
Okay. So that's really interesting, and anyone who wants to contact Rob or myself directly, you can do so if you have any issues with potholes, etc., and we can forward that information on for your behalf. Question number 3, Carl, is where will the 20-mile-an-hour start and finish? Can some of the double yellow lines be put by the Masonettes by Highbridge Road, where vehicles are regularly blocking the pavement or parking mainly on the pavement?
Okay, the schemes that we've just completed had there were schemes that came to us via requests from public, police, councillors, and we prioritised them, carried out the consultation, informal, then formal, just to tease out the issues, and they're the ones that are in place. Any others now we need to treat as a new request. So I would make a note of the location on the Vesey request list for highway measures, and then they can either be added on to any schemes we agree this year, or if the funding is fully allocated, they remain on the list, and then we can try and get them onto the next financial year schemes. And then we would carry out a consultation to tease out exactly where they were required, whether it's just one arm of that junction or more, and whether it's a single yellow line or double, because obviously double yellow lines mean no parking at all 24/7 unless you're disabled blue badge holder, where you have 3 hours, whereas a single yellow line can be more flexible, and we can restrict parking just during certain times. So we'd look to tease out the exact details of what the issue and what the solution is.
Okay, so I've now got another 2 questions. This next one has been brought up before in one of our previous ward meetings, and it goes, what about the dangerous parking situation under the railway bridge at Wild Green Station on Station Road? This should be a no parking area.
Yes, we've looked at this more than once before, under the old safer routes to train stations when we had a budget then. We initially years ago put a long single line to try and ban the parking, and then I recall a few short years ago myself and Councillor Pocock walking the road, knocking on some doors, speaking to residents and agreeing the extent of the restrictions that are in place now, and that was what was agreed at the time. If people now want additional restrictions going a greater length, then again the same process as just mentioned, we need to get that on the list, and then we'll carry out the consultation and take that forward. Okay.
So 2 very quick questions now, finally, and then we'll draw this item to a close and we'll move on to the next item. So Ray Nadin Drive needs dropped curbs for access from Westwood Road to schools. And is Westwood Road going to be resurfaced?
Okay. I don't recall Westwood Road being on the list. I would have to check. And again, I can request that can assess this for the future programme, and again we welcome any requests for drop curbs, and we'll add those to the list, and it's simply a case of trying to do as many as we can with the funding that we have.
Okay guys, so hopefully that answers all the questions that have been posted live, and thank you very much for doing that, because it's worth a treat, I feel. If there's anything else that you need to ask, please don't hesitate to email either Rob or myself. So thank you very much, Carl. And at this point, in a live meeting in the Carpenter's Arms, we give you a little round of applause. So there you go, the little round of applause from me. So we'll move on to item 4, which is policing and community safety. Because we can't get outside presenters in on these live meetings yet, I've had an update from Sergeant Heather Jones rather, from the Sutton Vesey Police, and I'm going to read out the statement that she updated me with to you. So it goes a little like this. A specific patrol plan has been put in place with at least 4 officers now from in the park, in Sutton Park, from 3 PM till 10 PM, covering all the gates. when instances of semi-social gatherings started, there were not the resources in place to tackle the issue. However, West Midlands Police are now linking with safer travel teams and British Transport Police, as there have been a lot of groups coming into Sutton from out of area who are now being stopped en route on the buses and trains and being turned away. So that's a little update on what the police are doing in Sutton Park at the moment. The focus of West Midlands Police has been, and our neighbourhood teams, has been focused over the past few months over the COVID response. Therefore, you would have seen far fewer of our local PCs on the street, but because of the lockdown, home burglaries and crime in general has pretty much dropped to zero, which is why we don't have any crime stats updates for you today. But because the police are returning to business as usual, we're starting to see that creep up very, very slightly. So there have been fewer police patrolling the wards. So as they're getting back to business as usual, they've started to see a lot more push bike crimes, mainly in the park through robbery and theft, and also through robberies through garages and homes. So the police have now set up bike marking sessions in Sutton Park for residents. They can't, however, set up a meeting because that would go against the COVID guidelines, but what you can do is log on to West Midlands Now, and I'll post the details up on the chat for you. You can log on to West Midlands Now and book an appointment for that, and they can either come to your home or they'll tell you when they will be out and about in Sutton Park. Finally, the street watch groups. They're starting to work on bringing the street watch groups back out into the open, and they're working on a way of doing that safely via the COVID-19 rules and regulations. So if you're in a street watch group, you should be hearing from SatPal very soon. Does anyone have any questions around policing, etc.? Let's have a quick check. Nope, so far no. So what I'm going to do is now hand over to Rob Pocock to cover item 5, which is the coronavirus public health update, and I'll leave him to introduce the Director of Public Health, Dr. Justin Varney. Over to you, Rob.
Thanks, Kath. So we're delighted to have with us tonight Dr. Justin Varney. He's the Director of Public Health for the city. I chair the Health and Social Care Scrutiny Committee on the City Council, and Justin occasionally has the pleasure of coming to our meetings and getting grilled. And I recall about a year ago he joined the council innocently, I think, from Public Health England, never realising a year later that he'd be right in the thick of one of the most major health impacts we've had in hundreds of years in this country. So he's had a massive amount of work to do. He's spent morning, noon and night, if not talking to councillors, being on the media and liaising with many parts of the healthcare system, a complicated job. So we thought, Justin, if you could go through tonight, basically an update where we are in the city on the COVID situation response. Specifically, the members watching this may not realise this, but the data, when broken down to a small area level in the city, does show our ward, part of our ward and the neighbouring ward of Irvington to be actually the spike hotspot for deaths in the city. And Justin obviously is having a look at what might explain that surprising result. We had expected that other parts of the city might be more vulnerable, but here we are in Vesey ward with an exceptionally high level. So obviously we'd be keen for you to explain a bit more about what you think's behind that. So over to Justin.
Great. Thank you, Councillor, and thank you for inviting me to join you tonight. So I'll just talk through, to begin with, a little bit about where we're up to with the COVID outbreak, and then I'll talk a little bit in more detail about what do we know at a level below the city. So as of yesterday, so the new figures are published each day, we had just over 3,000 cases. Yesterday was our first day without a new case being announced through the national data, but it is important to recognise that the national data only reflects one bit of the testing system. So I do know through the other bits of data that I get, unfortunately we did get a couple of other cases, we still are getting cases every day, but they are definitely much lower numbers than they were before. And just to put this in context, we look at the rate of cases, so we look at the number of cases per 100,000 population, because obviously Birmingham is the largest authority in the West Midlands with about 1.2 million people. So 1% for us will still be a very large number, whereas for Solihull or Sandwell, which are much smaller authorities, much smaller numbers. So one of the ways of kind of calculating and being able to compare is looking at it as a rate. So currently Birmingham has the 6th highest rate of cases in the West Midlands. So we're currently tracking after Stoke-on-Trent, Solihull, Sandwell, Wolverhampton and Walsall. And when we look at how we compare with other core cities, so the other major cities outside of London, we have the 5th highest rate behind Sheffield, Newcastle, Liverpool and Manchester. So in terms of the city is doing quite well, I think, and that's a reflection of what everyone in the city has been doing to maintain that social distancing of 2 meters, to wash their hands, to stay at home, and to be very alert to this virus, because it's those things we each do individually that makes a difference. I would say that pretty much since the beginning of June, the rate in Birmingham of new cases has been much lower than it was in previous months. So we are definitely on the kind of downwards bit of the slope. We are still seeing new deaths every day, unfortunately, but those numbers are coming down significantly. So I'm very optimistic. Members know that I tend not to be particularly optimistic in this situation, and I have been kind of preparing everyone for the worst since really early January, I think, and I met with full council in February to start talking about this. So we were preparing for this, and I think some of that preparation has played out. I'm going to talk a little bit about what we know about deaths, and then I'll focus a bit more on the kind of ward level data, or the sub-ward level data that was released by the Office of National Statistics. So what we know at the moment is predominantly based on information of deaths in hospitals, and that's because they're reported much more quickly than the deaths that come through the death certificate, because there's a delay between someone dying and when the bit of paper is filled in and registered with the registry office and then given to the Office of National Statistics. So when you look at death data, it's really important to look at the dates, because it does vary quite a lot. And up until the 29th of May, for Birmingham, we'd had just over 1,100 deaths that were related to COVID. And for the year up until the end of May, what we'd also seen is overall we'd had 5,300 and a bit deaths, and that's compared to the average for Birmingham, which is about just over 3,850 deaths. So as you can tell, there is an excess death, and that is almost completely attributable to COVID. There are a couple of hundred deaths that aren't attributable to COVID, particularly in April, and we are doing some work to look at that in much more detail. COVID does kill people who are older more. So there are a series of risk factors we're increasingly understanding about who is most likely to die if they catch COVID, and age is the most important one. If you are over 80, your chances of dying if you catch COVID is about 1 in 5. Whereas if you're under 40, it goes down to more like 1 in 100. It's a much smaller percentage. And that risk increases if you're a man, it increases if you are obese, and it increases if you have long-term conditions like diabetes, high blood pressure, or kidney disease. And it is also increased in people from particular ethnic communities. What we don't know as yet is how all of those factors interact, because unfortunately, trying to get all of that information on the same person is really difficult. So what we have at the moment is national analysis, which looks at age, gender, ethnicity, and long-term conditions, but doesn't talk about obesity. And in some of the studies doesn't talk about long-term conditions. So we're still learning, and that's just because of the data sits in different places, and trying to join it up is very difficult. We don't have any of that data at a local authority level. So it's only able to do that at a national level because the Office of National Statistics joins up the data from the death certificate with the data that they hold for the census, and that's how they make that connection. And we have to keep in mind that still a large proportion of deaths are happening and have happened in care homes, where there isn't the same data recording that there is in the NHS in the hospital setting. And even in the hospital setting, we know about 10% of records don't include important data like ethnicity. So there are still significant issues there. I'm going to just touch briefly on the information we have at a lower level, which was published by the Office of National Statistics a couple of weeks ago. And it's first of all, it's important to highlight that data only looked up to the 17th of April. That was just ahead of our peak. And so what it did was they produced a map which showed you what's called a medium super output area, how many deaths and what percentage of the overall deaths were attributable to COVID. And we've done some more looking at that, and we've looked at the wards where more than 50% of all deaths were attributable to COVID during that period. And when you start looking at that, actually, Sutton Vesey falls down the scale because people were dying for other things. The other thing is that there is a very strong correlation between the wards that had the highest number of deaths and the areas and the number of care homes. And so that also is one of the factors that comes into effect. So those are the kind of reasons why we think that's where we saw the spike earlier on, is that was impacting. At that point we were starting to see deaths in care homes, and it was impacting on more of our elderly population. And so the areas of the city where we have more elderly populations, irrespective of wealth, have been hit harder. And that's one of the challenging things about this outbreak is COVID has hit many different bits of the community. It has hit some of our poorest areas hardest, but it has also hit some of our more elderly populations pretty hard as well. So there are a combination of factors going on. But when I look at those small numbers, and they are small numbers, the highest number of deaths in that period attributable to COVID was 11, and that was in Lozells West. So we are talking small numbers in these areas, so I wouldn't read too much into it at the moment, but I would expect, given some of the population dynamics of Sutton Vesey, some of this is reflecting care homes, some of it is reflecting your elderly population as well, who may well have been hit quite hard by that. So in terms of where we are now, numbers are flattening out. It is really the decisions we all make over the next months, weeks and months, before, in terms of keeping that 2 meters social distance, keeping the hand washing, keeping alert, taking that responsibility, and the decisions we make every day that will prevent a second spike. There are two things that will end this epidemic. One is we get a vaccine that works, and that's then rolled out for mass vaccination. Now, I expect that with a good wind and good luck, we will get a vaccine that works probably in August to September. And then we're probably looking at 3 to 4 months before that vaccine will be manufactured enough to be able to be given to everyone. So it will take a while once we find what works for it actually be rolled out to give everyone the vaccination. And it will be a voluntary vaccination, as all immunisation and vaccinations are. But frankly, why wouldn't you want to get this? You know, it works, it'll be safe, it's important to do it. The other thing that would make a significant difference is if we get good drug treatment so that people who catch COVID we reduce the risk that they die. At the moment, because this is a virus, antibiotics don't work. So if you go into hospital, what we're doing is what's called supportive treatment. So we haven't got a pill that we can give you that specifically treats the virus. Instead, we're giving you oxygen, fluid. We're trying to treat the symptoms of the virus rather than being able to find a drug that actually works to kill it. There are lots of trials going on. There isn't anything that we found that works effectively at the moment. The final thing I would just say is on antibodies, because I know that often comes up. Please, please, please do not buy an antibody test off the internet. There's a lot of people selling fake stuff out there at the moment, and the postal kits have been withdrawn by the Medicines Regulation Agency. We at the moment do not think that if you have antibodies, you are safe from catching it again. And that's because the coronavirus family is the same family as the common cold. And as we all know, you can catch the common cold more than once in a year. So what we don't know is if you have caught COVID-19 and you do turn out to have antibodies, whether that will protect you from catching it again and whether it protects you from carrying it and spreading it to other people. So that's why the antibody test at the moment is really just kind of curiosity's sake more than anything else. You know, my advice at the moment is if you want a healthcare test, if you need healthcare, go to the NHS. Please don't go to a dodgy website, because there are sadly some charlatans out there, and there's some dangerous stuff as well going on. So hopefully that's a reasonable oversight. Happy to take any questions.
Great, thanks, Justin. You have provoked a lot of questions actually, so I hope you haven't got anything booked before midnight. I'll do this as quickly as I can. And Patricia's asking, where can we see online, down to ward level, or ideally first part of postcode, the rate of infection? Is that data available?
No, it's not. So it's really important to recognise at the moment there are still significant limitations in the data that we're being given. So we are only given in the public domain data for the city. And it is only over the last 2 days that I have been given, as Director of Public Health, restricted access to the more detailed data on the individuals who are now coming through the test and trace system. But, you know, we are now almost 3 months into this outbreak, and we have at no point had access to that data at a ward level or below that. So you can't get it, I'm afraid. You can only see it for the city as a whole.
Thanks. Thanks, Justin. Does that mean the data's there but we can't see it, or there is no data?
So there's two things going on. One is the data's in different bits of the national system. So when we talk about testing, there are two ways that people get tested. If you have symptoms of COVID at the moment, you ring 119, or you go onto the NHS website or the .gov website and you book a test. And that's either a drive-through test or a postal test. Those tests go to the private labs in what's called Pillar 2. That's the data that we don't have good access to. The tests that are done in hospital sit within the NHS labs, and that gives us a lot more intelligence, but it does sit within the NHS. So I, as a Director of Public Health, do not have access to that data directly. I have to get it kind of third hand through Public Health England. What we're only just starting to see through test and trace is those two pillars of testing coming together, so that finally we're getting the number of people that are testing each day through both pillars in the same place in the same spreadsheet. And as I say, that has literally only happened in the last 2 to 3 days.
Brilliant. Brilliant. That's great to get such a contemporary update, and obviously I think it proves that, you know, we're learning as we're going along with this condition. two linked questions. Kate is saying, I witnessed hundreds of young people gathering in Sutton Park on several occasions recently. Are you expecting the second spike because of this? And similar question from Martin. This is putting you on the spot. Can Justin comment on the risk of a second wave?
So I am concerned that we will see a second spike because people have gone to the beaches, gone to Lickey Hills, gone to Sutton Park and forgotten to wash their hands and see their mates and just get overwhelmed and have a hug or a handshake or a high five. And you know, that is a risk. We did see, I think, some increase in numbers that links back to the VE Day celebrations, where people again got a bit carried away and forgot. I haven't seen, and we haven't been able yet to do the kind of detailed analysis, but certainly looking back at the numbers, it looks like there was a little bit of a hike. So I do think we probably will see some increase, and I would expect to see some increase as lockdown relaxes. You know, as we start to go out of our houses more and we start to see more people, we start to touch more places that other people have touched, those common touch points of door handles, banisters, those kind of things, you know, that will spread the virus more. And it's important to remember that all of the work, the national work, suggests, and it's showing through actually in the antibody tests in hospital as well, only about 1 in 5 in the population has caught COVID so far. So 80% of us still haven't had it. So that's a lot of people that could still catch it in a second wave. And that's really important to keep in mind about when we take these cautious steps back into opening up lockdown.
Thanks again, Justin. Another question on data. Is there easily available data for Sutton Vesey ward and Sutton Coldfield more generally on just the numbers of deaths, the total number of deaths? I think you said there was something over 1,000 in Birmingham. Do we know how that's broken down by ward?
So we don't have that at the moment. We are working with the registry office to do that analysis. One of the challenges we have, and just to share some of why this is so difficult, for example, is that the registry office database doesn't routinely record postcode. So we haven't been able to get a really easy lift Excel spreadsheet with all the postcodes in it. What we've had to do is get the addresses and work backwards to try and join the dots. You know, and we also know nationally that the ethnicity, for example, is not recorded on death certificates. It's one of the reasons it's taken so long to be able to identify the differences in you know, in relation to death rates. So we are looking at how we might be able to do it, but it's not routinely published. We think the ONS will do another publication on the 19th of June of some further analysis. I hope that will also do the ward level data analysis, but at the moment they haven't told us exactly what it's going to include.
Okay, thanks. Another question from Ray, who's asking whether it's possible that someone can be tested to see if they have had the virus. I know there is a test, an antibody test. I don't know how reliable it is, but if you're a general member of the public and you want to find out, have I had it, can you get an answer?
So the simple answer is no, not at the moment. So antibody testing is reserved purely for the NHS to begin with, and the focus is on hospital staff. And I think most people can understand that. You know, we need to understand how many people in the hospital have caught it, particularly because in some other parts of the country there have been some outbreaks specifically amongst staff in the NHS. And there was a hospital recently that had one in a different part of the country. So that's the focus. First is to look at NHS staff working in hospitals. Then I expect that will go to GPs and primary care. Then I hope it will go to social care staff and staff working in care homes and other essential workers, and then we'll get to the general public. So look at how we rolled out testing for people who are symptomatic. I expect it will follow the same process. And as I say, I would not waste my money on a private test at the moment. 1 in 5 of us have had it, 4 in 5 haven't. It doesn't change anything in terms of keeping your social distance. Even if you test that you have got antibodies, doesn't mean you can go and see your parents or see your family or give them a hug. It makes no difference at all. So please don't waste your money.
Thanks for that. Maybe also following that on, Jasmina asks, how reliable are the COVID-19 tests?
It's a good question. So as I've said before, the antibody test, if it's taken from your arm, is very reliable. If it's you doing it at home with a postal kit, it's not particularly reliable, which is why it's been stopped, because that was never the way it was designed. For the swabs, the tests that are looking for if you've currently got the infection, and these are the kind of giant cotton wool buds that go in your nose and the back of your throat, if they're done properly, they're very, very accurate. If you don't follow the instructions, then they get less accurate, and that's one of the challenges with the postal test, is that actually if people aren't doing it properly, then it's not great. So you do have to make sure it goes right to the back of your nose and right to the back of your throat, because that's where the virus lives. The other thing that's important is doing the test when you've got symptoms. Actually, if you haven't got symptoms, it's much less reliable, and that's why we say the optimate time to get the test is in the first 5 days of developing symptoms, because we're most likely to be able to find it then. If you do it on day 1 immediately straight away, sometimes the virus is in your lungs, but it hasn't quite got to the back of your throat yet. But generally, these are very reliable tests. They don't do false positives. That's one of the key messages. So what they tend to do is there's a small number that say you're negative when you're not, but it is a small number. What they don't do is say you're positive when you're not, which is useful. So they're the 2 things we look for in a test: is false positives, told you you've got it and you haven't; false negatives, told you you haven't got it and you have. In this test, that's the risk, and that's particularly for people not following the instructions.
Thanks, Justin. Interesting next one. Do we know anywhere in the world where anybody's had it twice?
So this is an area of a lot of interest. There were some cases in Japan that were reported where people have had it twice. I think there've been some cases in South Korea as well. And one of the problems we have is that we have only recently got antibody tests that work across the world. So we don't know whether the first time they had it, they developed a defense, or they had it very mildly and they didn't develop a defense, and so they were able to catch it again. So there's a lot of research going on into that space. What is also important to know is that viruses are very good at kind of slightly tweaking the way they look. And we know with the COVID-19 virus, there's the original strain that came from China, then it went to Iran, and Iran, the strain that arrived in Iran, is slightly different from the strain in Italy. It's not so different that we don't think a vaccine will work for both strains, but it's a kind of variant. And what we don't know is if you caught the Iranian version and then you get exposed to the Italian version, which is slightly different, will your body defend you at this slightly different version? And when we say about slightly different, is think about this as the virus has changed a button on its coat. And that's all the difference. It's not a major difference, but it's big enough that if you're on a complete identical match, you won't see it as the same thing, because there is that small but important difference.
Great stuff. I've got 3 more questions. We have a trader, a retailer in Boldmere, is about to reopen next week, I think it is, and asks if there are special localised guidelines which you would wish us to implement.
So we're not issuing additional guidance for workplaces. because I think it's been pretty comprehensive in terms of the national guidance. What I would say is if you're an employer and you go through those guidelines and there's something that you don't understand or you don't recognize, or you kind of go, this doesn't work for the environment that I have or the business that I have, then reach out through the council website, through the kind of normal trading standards. Environmental health team are probably the route you know best, so come in through them. They know how to get hold of my team to provide advice. The other thing I would say for any businesses is do check the government website very carefully. So some businesses are allowed to reopen on the 15th of June, not everything. So hairdressers, unfortunately for me, barbers aren't going to be reopening then. Some of them will be coming a bit later. So do check the website because it's very clear on what can and can't reopen. And there's very specific sectoral guidance for different sectors.
Thanks. Yes, over this period, I've watched that beard grow with great admiration, actually. It's a stunning achievement. And it'd be a shame when they do reopen, actually. We don't want to lose it. I'm sure you could get some money for a sponsored beard removal operation. Francis is interested in the arrangements that have been made very constructively about housing the homeless during this period, and government's funding has helped this. Do you know if this is going to continue?
So there's been some initial discussions within the council about this, and I understand there's a paper going to cabinet on this about what the council would like to do. There are also ongoing regional and national discussions. As some people will be aware, ahead of the government announcing its approach, Birmingham moved very quickly to support people that were living on the streets to move into hotel accommodation. Several members of staff moved into the hotel with them to provide wraparound support. We've had drug and alcohol services, mental health services going into the hotel to provide really, really focused support. And many of those people have now moved into secure accommodation, which is fantastic. I mean, that's a really positive outcome of this. So the challenge is it's a very expensive model. And the money we've got from government has kind of covered some of it, but not everything, as well as the money that we've been giving to support the homeless sector in general. But I know that Councillor Thompson, who's the cabinet member that leads on this, is extremely passionately committed to finding a way to move things forward constructively, and has been lobbying regionally and nationally to go, you can't turn off the funding yet for this. We need to be really sure it's safe before we basically put people back on the street. So it is an area of real focus in Birmingham at the moment.
Thanks for that. We've got one more to go. I've been holding this one up, Paul, who sent it in, because we'd like to ask you to speculate occasionally rather than just give an objective scientific verdict. So the question is, which is a national question really, what do you think is likely to happen with schools in September? Unless the government say they will waive the social distancing for schools, then this member, the public, can't see how it can possibly open properly again. Obviously very concerned about their child's education. Have you any steer on where this may be going?
Yeah, I think I spend a lot of my time crystal ball gazing about where we might be going with this. I think there'll be a couple of things which will help tell us over the next month or so. If we start to see a second spike emerging over June and July, then one thing that might be happening is that in effect we get that second spike and then we get a lull, and that lull coincides with September term reopening, and by that point more of the population may have got it, and therefore the risk is less. The other thing that is one of those two game changers happen. So we get decent treatment or we get a vaccine. And I think decent treatment is much more pivotal to whether schools will be able to really fully deliver in September. I think most of the schools are being very pragmatic about this. I've been meeting with head teachers through the outbreak to talk to them and to answer their questions as openly and honestly as I can in what's a rapidly changing position. And we work with them on a very detailed risk assessment. And the reality is that social distancing is here to stay until we get either treatment or a vaccine. Whether the government might in September reduce the distance of social distancing to say 1.5 meters if we've had a second peak could be something that might be considered. However, I think the 2 meters has saved a lot of lives. And the reason I think that's important is that most of us are not very good at judging size or distance. So if you ask someone how big is 1 meter, generally what they gesture is about 50 centimeters. Whereas if you ask them how big's 2 meters, very few of us are 2 meters tall. So we know it's at least a person between us and another person lying flat. And that is definitely over the meter. That is the kind of international guidelines. So I think it's quite hard for government to change that, because I think actually it has saved lives. But I think if it doesn't change and we haven't seen a significant difference in treatment or vaccine, I think we will probably see schools return with a much more blended model of teaching, some of it at home, some of it in the classroom. I know the universities are planning for that. And we probably will still see the bubble approach. So it may be that year one's in on a Monday and year two's in on a Tuesday and year one's back again on a Wednesday, because the schools just don't have the footprint to have everyone in and have 2 meters distance. But we at least have time. And I think I do support the government's decision to not force schools to open this term. I think what we should be focusing on is getting children who are vulnerable back into school. That's been a provision all the way through this. 80% of schools in the city, I think, have remained open for vulnerable children and key workers. And we're still only, I think, about 20 or 30% of vulnerable children have taken that opportunity up. It would be great to see more of those vulnerable children getting back into school, at least for a little bit, before the end of the summer term, so they can just get a bit of extra support, and we can check in on them as well and see if there's any more that we could do to support them over the summer. And then we've got time to plan for the autumn. But I think it's still going to be a strange place, and I think we will not be back to what we would consider normal until the end of the year.
Can I comment on that as well, if you don't mind?
Yeah, go ahead, Kath.
Thank you.
Kath has a question.
Well, less of a question, more of an observation, really. So I'm the chair of the Children's Education and Social Care Overview and Scrutiny Committee, and I've been in conversations with the Director for Education, the Special Education Needs Department, the Assistant Director for Schools, Cabinet Member as well. And there are some great initiatives out there going forward, and there's money being rolled down from the government as well, which we're looking into to enhance online learning for children, because there are a cohort of children out there who actually are thriving in this environment, and those are the children who are school refusers, children who really struggle with their anxiety and their mental health. And we're making great strides in trying to enhance that side of the service. Now, there are some issues around the statutory requirements that need to be met, that could possibly need to be changed, that might hold things up. But as Dr. Varney said, the most important people are the vulnerable children out there. And as the schools start opening up and those children come back into school, we can see safeguarding issues being referred, and that going up ever so slightly as the children start to come back into that environment. So they are 100% the most important people in this scenario when it comes to opening up of schools. Now, that's not to say that, education isn't important for everyone, but we need to look at different ways in the time being to get children to access their education in different ways. I'll leave it there.
Thanks, Kath. And I think there's an opportunity Thanks, Kath. And I think the opportunity is there now to thank Justin very much for his time. You've done a great job in fielding these questions. If there ever is a COVID mastermind, I would enjoy sitting you in the hot seat, answering the questions. And very many thanks to the members of the public for sending those in. I'm sure we'll want to see you again if you can spare the time later in the summer or at the autumn Ward Forum meeting. And I know that, as you say, we are not going to be through it by then. So there will be material issues which we want to pick up when we come to the autumn. But thanks very much. You can now go on to Newsnight or wherever you're broadcasting next.
Thank you, Dr. Barney.
Right, my job is to introduce the next item. We're now on item 6. For those of you who've got an agenda in front of you, Parks and Grounds maintenance update. John Porter, who looks after Sutton Park and other parks in the north of Birmingham, can always be relied upon to provide a lively input to a public meeting. I'm not sure, John, if this is your first public meeting held from your sitting room or wherever you are, but I'm sure you'll continue to entertain us. So we're keen to know what's going on with parks, the grounds maintenance. The issue about Sutton Park has already been raised, so I'm sure we'll have some useful information to part with us. And you need to put your microphone on, John.
Yeah, we could debate that. I'm sure there's people who quite like the silence, but that's probably just family members. Wow, yes, I think what I should do is just give a brief history of how grounds maintenance has been affected by COVID, and then perhaps move on to Sutton Park as probably the topic most people will be interested in. And just as a taster, of course, we've all been shocked and horrified by the impact of COVID on the nation and the communities. But from my point of view, the message I got was, we're going to be hit by this terrible virus. Why don't you all go to the park? So when you work in parks, that wasn't the best bit of news I ever heard. And boy, did people decide to go to the park. We'll come to that in a moment. The grounds maintenance, first of all, obviously safe working practices affected the people who do the grounds maintenance, and we had to make some decisions informed by national policy. So we reduced to start with to some minimums, which is making sure that we did all the daily checks and safety inspections, and really concentrated on the essential things, and decided, really what were non-essential, and had to cut back on those sort of things. On highways, for example, we've concentrated on sight lines at junctions, and for things like sheltered housing and cemeteries, where there was the people that were there had no option but to use those grounds. If you're in sheltered housing, you need your garden. If you can't look after it yourself, then we decided to that was a priority, because people need to get outside for their well-being. Within parks generally, we started to partially cut the grass on the 11th of May, and we introduced a system of 2 metre wide strips to help people understand what social distancing was about, and begin to get a measure of what was required. And it meant that people could walk parallel to each other at no risk. For the wider grounds maintenance outside of parks, we are now just cutting grass with ride-on mowers, and the significant point there is we're not doing things that would require pedestrian work. So normally, in normal years, we'd be sort of strimming round lampposts and all that sort of business. We can't operate at those schemes at the moment because of the difficulties of transporting people without them getting too close to each other and interacting. We had to close outdoor gyms and playgrounds. which was regrettable, particularly while the schools are off. But the risk of contamination is just too great where people share those sort of surfaces and resources. And we continually replace the signage as people break into those facilities, which is sort of understandable given that May was absolutely glorious weather-wise, and we closed down all the facilities within parks. We have no visitor centres open. There's no ice cream operators. There's no toilets. Some cafes have opened to do takeaway services, and from the 2nd of June we opened our tennis courts and ball courts. We diverted a great number of staff into going around advising people to observe the social distancing rules. So we've put people into vehicles with loudspeakers, and we've just been enforcing the message, which has been particularly important in Sutton Park because we've had absolutely massive numbers of visitors. And although we appreciate the good sense of advising people to go outside for their well-being and you know, make use of their parks facilities, actually there was no additional resource that came down the line to do that originally. And as we heard earlier with the police, there was no police resource to support that work either. And we think our footfall has more than doubled. Now, some of the consequences of that have been the opportunists who have used their sort of social media to gather people into crowds, and it's been a little bit like a nightclub in Sutton Park at times. And actually, apart from it just being increased footfall into Sutton Park, we've had a completely new raft of users and people who aren't used to using the park and don't necessarily follow the conventions that we would expect. So that we've had people doing things like sort of barbecues and campfires, would you believe, and swimming in the lakes, which is prohibited, and actually just losing a bit of common sense, I think, really. Regardless of the COVID situation and all that is going on, you know, we've had fatalities in the pools in the past. The pools are what they are. We're in a nature reserve, and the cattle and the squirrels and all the geese don't go off to some sort of animal public toilet somewhere along the line. They actually use those facilities, and with all the sort of antisocial use that's gone on with alcohol and drugs and stuff like that, well, none of us can guarantee what's in the water, and there's been really quite some unwise parenting is the kindest thing I can say about some of the stuff that's going on. I know it's been very hot, but if you get a group of 20 teenagers that have decided all to go swimming, they're not social distancing, you know, the parents clearly don't know where they are, and we've struggled to keep a lid on those sorts of activities. It's just been overwhelming at times. We find literally thousands of laughing gas canisters, and it's just a completely new world out there, really. And about mid-May, I started doing the rain dance, and it finally came into effect at the end of May, and we've had some respite. And in the meantime, the police, once the resources were marshalled, have been maintaining a high presence, and we've been able to sort of kick back on the unwelcome and antisocial use that some opportunists saw in this crisis. Yeah, we want parks to be used. We need them to be used well. I think the other thing that's been quite striking during the time is for good reasons, people have decided to to spread out, and they've gone into parts of the park that normally don't get used, that are quieter. We've had nowhere that's been quieter of late, and that will impact on some of our special wildlife. Ground nesting birds, for example, we've had more dog walkers and people in quiet places, and it will affect some bird numbers. It's been a very, very difficult and strange year, and I'm sure there's questions, Councillor, if that's okay.
Yes, you have provoked questions as always.
Before you go to questions, Rob, can I just ask you, John, to give a bit of a shout out to the Facebook group Sutton Park Cleanup and all the work that they've been doing, because it's been pretty tremendous, the amount of people who are voluntarily just picking up oodles and oodles of rubbish from the park.
I think the silver lining to the cloud has been the positive public reaction, and although at the moment we can't encourage groups to come together, we've done a bit of work getting litter pickers and bin bags out to literally hundreds of people, and when we've had sort of Glastonbury Festival aftermath scenes on Meadow Platt and other places, there have been amazingly positive people who just rolled their sleeves up, members of the public, knuckled down and got stuck in. They haven't got into the blame business. There has been a number of people who think it's the council's fault if somebody else has dropped litter. It's not quite like that. We have been cleaning up on a daily basis, and I would give a shout out to the grounds maintenance guys who go back to the same spot day after day after day and deal with some shocking rubbish. I just don't understand why people can't A, use a bin sometimes, but B, take their rubbish with them. They carry it here. Is it that difficult? I don't know, but the good people have just been heartening, and it gives us hope, I think.
Yeah. Thanks.
I'll give you tomorrow. I'll send you a written description.
I'm sorry.
Yes,
John, I'm jumped in now. I'd endorse the points made about the community volunteers. I've got a comment on the chat, which is from Kate. Can I also say a big thank you to the Rangers for their hard work in very difficult circumstances. And Paul says thank you for all the fantastic work Parks maintenance team have been doing to keep parks out and clearing up after unwelcome and untidy visitors. Question, are extra bins likely to be made available due to the high numbers of visitors and emptying the bins? And another resident has said, what about play equipment areas maintained with clearing the weeds, and the bins need emptying more often? So is there anything we can do on that?
We have been emptying the bins more often. I think the significant problems we've had have been evening and nighttime use. So whilst we can leave the place looking good at the close of the working day, by the time we get in the morning, it's already Glastonbury too. We have now, returned to gate locking, and we've got the police enforcement. And during the day, we empty the bins more than once now to do that. It's from a personal point of view, I still don't see that as a sustainable answer. That will just endlessly pick up litter and dispose of it at the council's cost. I would still think there's great merit in people taking their waste home with them. That is the sustainable way forward, I think, really. And particularly if at home you can separate the rubbish and sort it out. I'm very keen on that.
Thanks very much. Thanks very much, Leslie. if you can put me back online, thanks. Great stuff, John. We've got a couple more questions about grounds maintenance more widely. Kate is saying there's still a few issues around the spinny. I know we did a little walk around that. And she wants to see if plugging can help. You might want to tell us all what plugging is. And she's also mentioned whether plugging in Sutton is a way forward for this. Just while we're on grounds maintenance, I can come in with a question from John, who's interested in the wildlife side of the grass cutting and whether we've managed to change the grass cutting to encourage wildflowers. Do you want to deal with those questions, John?
Yes, most certainly. Litter picking while you jog, I suppose, is the idea of plugging. Yes, we have some people who litter pick as part of their sort of their daily exercise, and they are green saints as far as I'm concerned. I operate a different system. I have a 5 a day approach. I pick up 5 bits of litter every day, and I think if everybody that came to the park went away with slightly more litter than they brought in, then when you've got 20,000 people each taking away a little bit of litter, then we end up with actually a much healthier sort of situation. We do have to celebrate these people and make sort of litter picking almost socially acceptable. It's sort of, I don't know why we think it's some people think it's sort of not right for them to do, or they can leave their litter. There's something culturally there to be addressed. I don't have the answer. Wildflower wise, there are now, I think I know which John this is. I am personally very keen on letting the grass grow to encourage wildflowers, and one way or another, this year we've done a lot of that, but it doesn't mean the regimes have changed. I have, with my managers, promoted a policy from Plant Life, which involves grass verges not being cut really for the summer period, which is when flowers are there, and of course the flowers support the bees and the butterflies and all the pollinators. But that's not gained support within my community across the city. So I am keen to try and push the Plant Life approach more widely. And again, I can send you a document if that's of interest to everybody. I would like to see that happen, even if it was only around the perimeter of Sutton Park, for example. Can we have some long grass all the way around instead of just close mown? There's a highways aspect, but we know Carl's a decent chap. He's listening, of course, so I've got to say that. But there are constructive changes to be had. And you'll know as well, we've experimented with wildflowers, and with the support of the town council, we're doing more and more of those things. A lot of the work stopped this year because of COVID. We were due to do some more wildflower work in March, but it all ground to a halt. It doesn't mean we've stopped, it's just that we're in a hiatus.
Thanks. If you can cut me in, Leslie. Thanks, John. I would think we'd all be interested in the document you mentioned. So if you can email it through, Kath and I can pass it on to anybody who gives us their email addresses. If you've had an invitation from Leslie, you'll already be on that list.
Oh, with your permission, John, I can post it on our Facebook site.
Yes, it's produced by a charity called Plant Life. It's not not my document. I will send it off. But I think if it's for John, I'm thinking of, who asked the question, he put me onto that.
Okay.
Is anyone interested in Haywood?
Okay, if you can cut me back in, Leslie. Thank you. I think that's come to the end of the questions for John. I thought I'd leave him with the last comment. I won't name the individual who's put this here, but he's intrigued about when the rest of us can't get a haircut, what's happened to John's amazing facial hair? The answer is John's hair has gone to Justin Varney.
But the other way up is the way I see it. You know, when you have testosterone like I do, growing hair is not a problem.
Well, on which I think if you can cut me in, Leslie. I think on that note, we need to move rapidly on to the next agenda item. Thanking John very much for his time, and I know he's been working his socks off like so many people have, and not always is it appreciated. I know how much hard work is done. Kath, I think you're taking on the next item, which is item 7, which is community group updates.
Thank you, Leslie, for passing over to me. I have, because we can't get outside organisations in to give their own updates, as with the police, I've got updates from Boldmere Futures Partnership, Eco Sutton, Age Concern, let me think, Bannersgate Forum and Vesey Ward Forum. So I'll quickly start with Vesey Ward Forum. They are currently producing another newsletter in Boldmere Pages. So they were trying to show how much of the community has come together, and they're looking for really good news stories to put out there so that people can share them and enjoy them. So if you want to email anything like that, email it to Rob and I, and we can pass that on to Ray on your behalf. So on to Boldmere Futures Partnership. I'll read this out in the first person. Boldmere Futures Partnership wish to announce that the Christmas festival won't be going ahead. We've had a virtual meeting and decided not to go ahead, with there being too much uncertainty, the potential for too many people to turn up in what is a public street, and the pressure that the organising team are under already. We're going to look at smaller events like community trails in the run up to Christmas instead, and we'll be announcing this publicly later this week. Eco Sutton have been looking into the proposals for the future of the Tyseley incinerator, and we think that any extension of the existing use of the plant runs against the declaration of a climate emergency and the target for carbon reduction by 2030. We hope that the City Council will find an alternative policy for the disposal of our waste and a positive use for the energy produced from any residential waste incineration. We look forward to contributing to these discussions. That's John Hayward, committee member for Eco Sutton. Now, I brought this question up with the leader of Birmingham City Council yesterday, and there is an update going to be sent out very, very shortly, so we'll keep you updated on that, Eco Sutton, when that gets published. We'll put that there. Rob, if you want to comment on that at all, if you've got anything to say.
Yes, I can just add a bit more to that. I'm involved in a small working group which is looking at this thorny issue, and the intention is to adapt the City Council's current policy with replacement of Tyseley incinerator with a more environmentally progressive set of alternatives. This is quite a controversial area, and it's in the middle of a legal procurement process, so I can't really say exactly where the final conclusion of this will go. Basically, there are several companies have bid in to take on the management of the waste of the city when the Veolia contract comes to an end. What we're trying to do now is to ensure that those who wish to take on other environmental waste collection services do it in a way that meets the best environmental standards and helps us reach the zero carbon target for 2030. There's a discussion that I should be attending actually on Friday about this, and I think an announcement is going to be made early part of next week. And then, but believe it or not, it's another year and a half of discussions with people tendering to the work and discussing with the council what they're going to do. It's at least another year and a half before we finally get to the stage of there being a tender to be assessed. So I would say to Eco Sutton and all of others who have an environmental interest in this, there's a lot of mileage left in the debate, a lot of opportunity, I think, to turn policy into a more progressive one environmentally, and all power to all residents' elbows if they want to shout out and make their voices known. Back to Kath.
Thank you. Put far more eloquently than I could have done, Rob. Glad you're on that working group, being the bin meister.
I'm an expert in rubbish.
Okay, our next community update is from Age Concern Birmingham and Sutton Coldfield NNS. As a response to the coronavirus outbreak, Age Concern Birmingham and Royal Sutton Town Council have been working with the Sutton Coldfield Charity Trust and other voluntary community and faith organisations, including St James Church in Mere Green and the Sutton Coldfield United Reformed Church, to ensure that residents have been able to access the information and support they need. The Sutton Coldfield Together website was created in March for residents to request help and support for themselves or others. People were also able to register to get involved as a volunteer to help support community groups and organisations at this time. Sutton Coldfield NNS, which is delivered in partnership with Compass Support, has been in regular contact with community groups and organisations to establish what services and activities, if any, they have been able to offer at this time, and are working with groups to explore what support they need to adapt, restart and develop activities as we move forward. They are also working closely with the local adult social work team to support citizens and to identify any gaps in support and services available in the constituency in the short and longer term. In March, Age Concern Birmingham adapted the service and support offered to focus on the provision of emergency food supplies, hot meal deliveries, shopping services, wellbeing checks and telephone befriending. A telephone line 0121 362 3650, which I will post on the chat, was set up with residents who could contact Monday to Saturday between 9:30 AM and 4 PM, and this will continue to be offered during the remainder of the coronavirus pandemic and beyond. Working in partnership with St Giles Hospice, a new bereavement support point for anyone in Sutton Coldfield who needs emotional or practical support around the death of a loved one, has been developed, and this is currently available virtually on Wednesday mornings, with a view to this moving online and being held in the community cafe when it is possible to do so. The support point can be accessed by calling 01543 434 536. Again, I will post that in the chat for you. This week is National Carers Week, and Birmingham Carers Hub continue to offer advice and support to carers in Birmingham. Carers can register by calling 0333 006 9711 or emailing the team on info@birminghamcarershub.org.uk. The team are carrying out statutory carer assessments over the phone, as well as giving advice on things like welfare benefits. The team are also proactively contacting registered carers to offer safe and well checks and to tell people how to apply for a free carers card, which gives lots of discounts and benefits. The community cafe on Boldmere Road is now open for a takeaway service, and the charity shop will reopen with social distancing measures in place on Monday the 15th of June. And finally, Age Concern Birmingham have also recently launched a fundraising campaign led by trustee Margaret Burkett. The aim of Margaret's mission is to raise funds to enable the charity to provide ongoing support to older people in Birmingham, and donations can be made through the Total Giving website or by calling the Age Concern Birmingham helpline number. So that was quite a large update from Age Concern, but all the details that they've mentioned there and all the support that you can get, I will post in the chat so that you can copy and paste that for yourselves or copy it down. And finally, Bannersgate Neighbourhood Forum. Just a brief update for the ward meeting. I am hoping to continue the tablet course in the next few weeks. It will be for small numbers, not more than 5 at a time. Initially, it will be the equivalent of a lesson where everyone does the same thing by following what appears on a screen, but the last part of the session could be for specific problems. For further details, contact me, and me being Tony Willis, through bgatepost@gmail.com or through the Bannersgate Neighbourhood Forum. And again, I'll post those details on the chat for you all. So that just leaves me to pass on. Are there any questions first of all? Let's have a look. Not that I can see.
Kath.
You've got a question, Rob? Go on, Rob.
Okay. Thanks. I think it's a question to all our audience watching this show. We're wondering whether to run another one of these, and if you think it would be a good idea, please just stick a yes in the chat event, and it will help us decide whether we might want to put another one on in July. I think it would be useful feedback to know whether there's an audience out there wanting to do another one. Thanks, Kath.
Very good point, Rob. Yes, if you could just put that in the chat, say yes, and we'll go about the business of organising another one. The next item is any other urgent business, which I'm thinking is going to be difficult to do if we can't hear residents, but if you can again use the live Q&A to post your questions. Thank you, Kate, for saying yes. This is much more efficient than the usual format. I think you're right. We'll all be home before 9 PM tonight. So on to item 10, which is future meetings, and the next one will be confirmed in due course. And that, of course, leaves me to just say thank you very much for everyone who's attended live this evening. The whole meeting can be watched and rewatched over and over again at your leisure using the same link that was sent out. Rob and I will also post this link again on our Facebook page and on Twitter for anyone who wishes to access again. And I do believe, Leslie, can you confirm this for me, that it's also available on the Birmingham website?
It will be on the Birmingham website eventually, not imminently, whereas
okay.
It will be imminently within about an hour of this finishing. The meeting recording is there on the link. Oh,
okay, so give it an hour and we'll be able to watch ourselves back and really criticise what we look like on live streaming. But thank you very much to everyone who attended. Thank you to Justin Varney, thank you to Carl Randall, thank you to John Porter, thank you for all the community groups who made the effort to give us an update in writing so that I could get their information out there to you all today. And thanks, Rob.
Great, well done. Yes. Good night.
Should we go live to Rob so he can wave?
I'm waving. I can only just pick up the hand there. I've really enjoyed the show.
Angel.
And we'll look forward to seeing everybody as soon as we can arrange another session. Thanks very much.
Good night.
Good night, everybody.
Good night.
Good night.
We're closing now.